Hello there, I'm Rosemary Barton. Here's what's at issue this week. With new variants and hospitals pushed to the brink, premiers across Canada are calling on the federal government to negotiate higher federal contributions to healthcare costs. The premiers have launched an ad campaign to push Ottawa to increase healthcare funding by $28 billion. Manitoba Premier and Chair of the Council of the Federation, Heather Stephenson, says that the premiers are simply trying to get back to previous levels.
People are waiting in pain, and we need to get back to that partnership with the federal government.
The premiers want to sit down with the Prime Minister and make a deal. Do the provinces have a case that more funding is needed? Is there money to even give the provinces, given our grim economic outlook? Let's bring in at issue Chantal Hebert, Elamin Abdelmahmoud, Althia Raj, and Andrew Coyne. Good to see everyone on this Thursday. Althia, I'm going to start with you today on whether you think this request from the premiers has any merit. I mean, I think the meeting will probably happen. I'm not sure whether it'll go any further than that. What do you make of the push that the provinces are making right now?
I actually don't think a meeting is going to happen, at least not in the foreseeable future. The healthcare minister is scheduled to meet with his health counterparts in 2 weeks. That meeting's going to go ahead, but this meeting that the prime minister kind of had suggested that he was willing to talk with the premiers after the COVID-19 pandemic was over to talk about boosting that Canada Health Transfer is not going to happen until they have a framework in place with the majority of the provinces. That's what I'm told. And I would say that the ad campaign has not landed very well at all with Ottawa. I know that they are peeved, to use a more polite word than the words that were used to describe it to me. And they kind of feel like they're being held hostage. They don't agree with that number, obviously. That's like a number that this is an argument the federal government has made before. But what they're suggesting, frankly, is that they have very reasonable conditions. They're going to add more conditions that, frankly, were new to me, such as asking the provinces to make it easier for healthcare professionals to travel from one province to another, that the provinces come up with a plan to do something on foreign recognition of medical professionals, something that we saw happen during the COVID-19 pandemic. And also this that they've kind of floated before, but had not been said so explicitly to me, which is preventing the provinces from clawing back money that they themselves are investing in healthcare when the federal government re-injects money in the healthcare system. So they don't want to see, like, for example, famously, that was talked about during the Conservative leadership race, where Stephen Harper gave money to Quebec. Quebec turned around and gave its citizens tax cuts. They do not want to see that happen. And so that's going to be a condition that Ottawa is laying on the table. And I'm told that Ottawa is suggesting that if provinces like Quebec or Saskatchewan don't want to play ball, it's fine. They will make agreements with other provinces. And yes, there will be more money for healthcare, and they hope to have a plan in place by the end of January.
Well, that is something they've done with other things we've seen with daycare deals and other things, Andrew, is they just go off and make deals with provinces rather than trying to get everyone on the same page. The Premier's obviously trying to have this unified front. What do you make of it?
Well, the conditions that Althia talked about make a lot more sense than the usual things that this government and federal governments in the past have tended to want to get into, of dictating what kinds of things you spend the money on. You know, you have to spend it for home care, you have to spend it for mental health, et cetera, which is really not the federal government's responsibility. This is a situation where both sides are wrong. So I said I don't think it's sensible for the feds to be attaching too many strings to federal transfers, but at the same time, they shouldn't be just handing it over holus bolus either, because what you get then is basically two levels of government claiming credit for spending the same money twice. Yeah. And you get the same old blurring of accountability and the same old finger pointing that we're so familiar with healthcare, where nobody can really be held to account for the results, which are frankly not very good. So no, the provinces don't need more money in the short run. This is the same old game with them. In the long run, they do, because of population aging. What this really ought to be is the beginning of a longer term discussion about transferring the tax raising capacity to the provinces, so that yes, they get more money to deal with the aging of the population, but they have to be accountable to their own taxpayers for the result and stop blaming Ottawa when they don't like the results.
Well, the reform, I mean, I think everyone would agree is needed if you're going to give more money, because there are some underlying systemic problems. But I don't know if that conversation can even happen given all the things that Andrew just talked about there, Chantal.
Well, a reform is not going to be done or from the top down or from a federal government that actually doesn't run a healthcare system. Sure. So they don't even have the expertise to reform the system. And in an ideal world, a province would experiment without federal interference, and best practices would be copied by other provinces. There's a reason why Medicare was born in a province and not in the brain of some civil servant on Parliament Hill. Andrew is totally right, though. The provinces are piggybacking a crisis to say we need more money. And in the short term, money is not going to resolve the crisis, and it is real, that has been happening. It's the wrong conversation at the wrong time. That being said, and just for the record, the money Stephen Harper transferred to Quebec was not for healthcare. It was a more general transfer, and Quebec is spending a lot of money for healthcare. That also being said, I don't or can't imagine a federal government that would tell Alberta voters or Quebec voters or Ontario voters, oh, well, we're not going to transfer you money or more money for healthcare because we don't like the way your government is talking to us. That in the real world doesn't happen. They're nice fighting words, but they're kind of just making people despair that governments are feuding rather than trying to find a solution.
Except they might say, they might take some of those conditions, interesting conditions that Althia just laid out there, and say to them, you're not getting the money unless you agree to those, Elamin, and might Canadians be willing to accept that the provinces can have more money, they just have to do certain things. There have to be outcomes that are agreed upon.
I think, we've been around this bend enough times that people know by this point that premiers asking for more healthcare funding is probably the oldest sentence in the history of Confederation, I think, at this point. But I am really struck by the methodology. So I'm really struck by the idea of the premiers rolling out this ad campaign, because it does say that it's a bit more of an aggressive stance. It tells me that maybe two factors at play. One is, of course, all of this is in the shadow of COVID-19, so the argument is a little bit more comprehensible than it might have been in the previous years. But two, they might be seeing a vacuum. Right? They might be seeing a vacuum of the federal government not really taking on healthcare or not really talking about it meaningfully in the wake of COVID-19. Like, we're not really out of the pandemic, but we're not really in it anymore. Mm-hmm. And it makes a lot of sense for the provinces to at least seize this moment to try to turn that narrative around. Having said that, I can't imagine that it's a particularly diplomatic move, because as Althia said, Ottawa might get a little bit peeved about this.
And financially, it seems like, go ahead. Andrew's in there? Go ahead, Andrew. Yeah.
I just want to say that the worst thing the federal government could do for the cause of healthcare reform would be to pack in a bunch more money to the provinces. For 20 years, we've known, and more, we've known that the Canadian system is not functioning well. We spend more than most other countries. We spend vastly more than we did in the past for very middling results. We're not getting bang for the buck. We need to make systemic reforms. There's broad consensus on the types of reforms that are needed. They never get done because there isn't the political incentive. And frankly, there isn't going to be the political incentive until the provinces have to do it because they don't have the money. Every time the feds, there was a brief flurry of interest in reform about 20 years ago when the provinces were skint. Then the feds came piling in with more money to, quote unquote, buy change. Yeah. And instead what they did was they bought stasis. Everybody went back to sleep.
Chantal, and then quickly Althia, and then I'm going to take a break. Yeah.
But seriously, if Justin Trudeau wants to look like he's part of the solution, he needs to sit with the premiers and have this discussion rather than have it versus via sources who say it's going to be this or it's going to be that.
Althia?
Well, I think in the past, like when you think about Jane Philpott and Bill Morneau and the agreements that they had signed, they did line up everybody before they announced something. So I don't think it's strange that the Prime Minister would not want to sit in a room where he gets criticized by all the premiers until there's something more tangible. The provinces, to go back to a point Andrew made, don't actually want tax points. They want to be able to keep asking for money, it seems. Yeah. The other thing I would say is that I think that the federal government feels that there is a lot of goodwill for what the federal government has done during the pandemic, the $72 billion they injected. They feel like if they present the provinces with what they call a common sense proposal that is generous or seen to be generous, that they can get provinces on side. And I will remind all the viewers, we are in October. We're talking about something in January. There's a lot of posturing here. Mm-hmm. And this is more like a fight that's happening that is perhaps, this is not what the agreement's going to look like, I would say.
Can I just remind viewers for the same reason that at this point, the government that is more likely to face an election deadline is Justin Trudeau's government and not Ontario, Quebec, or BC.
Welcome back to another round of At Issue. The Bank of Canada raised interest rates again this week. The Prime Minister discussed how those rising rates will put the squeeze on people.
Obviously, Canadians are worried both about inflation, rising costs of food and prices on everything, and on the issue of rising interest rates, which will squeeze them in their mortgages.
So is there more the government can do to help support Canadians during these times? What could we expect from that fall economic statement, given the grim outlook? At Issue is back. Chantal, Elamin, Althia, and Andrew. Elamin, let's start with you on this one. I mean, obviously the government can't tell the Bank of Canada what to do. We've discussed that in the past. But there is a real pinch happening between inflation and this rise in interest rates for Canadians. And it would seem the government is going to wear it if they don't do more to help.
Well, actually, so I found myself thinking about Pierre Poilievre this week, and I wonder if he's not patting himself on the back for sort of picking the fight with the Bank of Canada early about the rising interest rates. Because as we saw this week, the NDP leader, Jagmeet Singh, is also getting into the action. He's also coming out as criticizing the Bank of Canada for raising interest rates. He says that the NDP is sort of taking a different tack on this. It's not quite the same as the level of that Pierre Poilievre is calling for the removal of the Bank of Canada governor. But all the same, we kind of might find ourselves in this odd position where the Liberals might be the only major party not to get at the Bank of Canada directly. And in that way, there is a clear villain. There's a clear sort of institution to point to that is responsible for some pain that might be inflicted on Canadians. And the Liberals might find themselves not having a lot to say on that.
What do you think, Andrew? I mean, the bank seems aggressively going after the inflation target of 2% and doing that by quickly moving interest rates, perhaps quicker than some other countries.
Well, and I think there's some evidence it's having effect. If you look at the 3-month average inflation rate in September, it's down to 2.4%. That tells you where inflation is rather than where it was a year ago. So we'll see what happens in succeeding months. But there is some progress. And it is one of these sort of deterrence theory kind of games is the more people believe the bank is serious about getting inflation down and getting it down in a hurry, the more likely they are to adjust their own wage and price demands in such a way. If they think the bank has gone soft and has been cowed by the kinds of complaints that we're hearing from opposition politicians, then people are going to say, well, they don't have the nerve, they're not going to do it, I'll keep on demanding these double-digit increases. So, the sooner we all get on the same page, the better. And as I say, I think there's some evidence that that's what's happening. I'm more concerned about some of the non-economic risk factors, like, for example, the war in Ukraine, like the U.S. midterms and how that might affect that, like the return of the pandemic. There's some signs of increased infection rates, et cetera. So there's a lot of uncertainty, a lot of risk factors, a lot of things to make people hesitate to invest quite outside of the short-term economic arena.
Chantal?
So what Andrew has described is events with a capital E that are beyond the government's control and beyond the Bank of Canada's outlook. But if the impression that the bank wanted to give was that it was going to be relentless, coming up with 0.5 point rather than the 0.75 point that everyone had been talking about, 0.75, on a week when the NDP joined the Conservatives, that is what they did, in saying these hikes are not appropriate, probably didn't send the message that this is a bank that will not be intimidated by public pressure. And for the government, they're between a rock and a hard place because they have to defend the independence of the bank, but they now have the two major opposition parties basically saying this is wrong.
Right.
And no one is coming back on the same page anytime soon, obviously.
Althia.
And the fear that a lot of people might find themselves homeless because they can't afford their mortgage payments anymore. Right. And for a government that spent the last 2 years saying, we're going to have your backs, that's a difficult message to navigate. But at the same time, I think we made this point last week, talked about this last week. I think the fact that there is this NDP Liberal deal allows Minister Freeland to course correct in a way. Like, I don't think anybody is expecting a very big spending in this fall economic statement. No. This is going to be a very prudent statement. Already, within the bureaucracy, you hear a lot about the search for cuts. We don't say the austerity word, but it is a dramatic signal change. So it is interesting to see how they are going to pivot in a direction that takes them away from that populist message that they are trying to court also at the same time.
But they do have to do something, don't you think, Elamin? I mean, they point to the things they've done, doubling the GST credit, dental, if you get access to it. I don't know. At some point, though, if you're going to be blamed for things, then you would think that there has to be some sort of action on your part.
Yeah, it's possible at this point that the Liberal play is to wait for the Bank of Canada to do the thing it is going to do and then respond accordingly. The problem with that is that it doesn't do anything to alleviate the impression that this Liberal government is not particularly plugged in with the concerns of people, with the concerns of the way the cost of living is going up and how to respond to it. Are the only measures that they have to respond to it inflationary? No, not at all. I think they could sort of come up with a package of direct relief for certain people that is targeted. And they could say, like, this is about helping specific families get through this difficult time. But the idea that they haven't come up with that messaging, or don't seem to be particularly interested or seized with that messaging at the moment, I think that's going to be the thing that damages it the most, because you have the other parties very willing to take up this opportunity.
Quickly to you, Andrew.
Short term, in terms of supporting people in low income, they've doubled the GST credit. I'm not sure they need to do a great deal more than that. What they do need to do is to support the bank, not only in rhetoric, but in policy terms, by keeping their deficits low, and also by supply side measures, the kinds of measures they talked about in the last budget, where for any given amount of money supply growth, you get more growth and less inflation than you would otherwise. So those kinds of moves to increase the flexibility and dynamic ability of the economy to produce goods and services is the best contribution they can make to supporting the bank.
Okay.
But is that not a, I just have to ask, is that not a willingness to say we are willing to wear the consequences of this, right? Whether it's lots of job losses across this country in the middle of a recession, that's a dangerous thing to wear.
They're going to have to anyway, one way or another. They're in this. They can't blame the bank.
I got to leave it there. We'll talk about this again and again. Don't worry. All sorts of things will happen. Thank you all very much.